Hi, this is Dr. Randy Grill. Commonly, I get a call from the medical POA. Mom's tooth is broken. It must hurt. Quick, let's get it out. And the first thing in my mind, I go, great, let's go up and take it out. One of the things I'd like to explain is 90% of my patients are female, and probably over 90% of my medical power attorneys are daughters, could be granddaughters. So when I say mom, it's just, that's kind of the world I live in. We have a few dads, a few granddads, but in nursing homes, in my practice, the nursing homes may have a bigger percent, but in my practice, I have upwards of 90% female, so we'll start there. A lot of times, in dentists that treat geriatric patients know that the older we get, the nerves shrivel up, they calcify, and the teeth get very brittle, and that's why when a tooth breaks, mom or dad don't hurt. The first thing we need to do is we do several tests, like we do a percussion test to see if it hurts. That'll tell us if it's abscessed. If they'll let us get an x-ray, we have a very high-tech, sophisticated x-ray. We get an x-ray of it to see if it's abscessed. We look at the gums. We do several things. We talk to mom or dad most of the time, and I'm going to use a percentage that I'm guessing. Most 80 to 90% of the broken teeth in elderly people in nursing homes don't hurt. That's because the nerves are calcified in, with no unexplained fever, no swelling, and they say there's no pain, and that is a challenge sometimes. If they cannot communicate, their behavior will change. We're always explaining to people, and the nurses and the caregivers and the medical POAs, if they slap at their face, if a dramatic change that doesn't have to do with a change in medications happens, they stop eating, then we know that we've got to do something. And the first thing I do when I get to the home is I look in their records, see if anything's changed. I decide, is it safe to do in a nursing home? I do a risk-reward ratio on how dangerous is it, and if it's safe to do in the home, we do it. If it's only safe to do in a dental office or with an oral surgeon, then we get them referred out to do that. If it's not safe, I will write detailed reasons why it's not safe and what's the risk. It can be as easy as they're on a medication that will not allow healing, they're uncontrolled diabetic, renal failure won't allow healing, and it'll leave an open sore that's extremely painful, trigger failure to thrive, and in an 80-plus-year-old female, everybody's different. It depends on their health, not their age. I have 90-year-olds that are as healthy as I am, and I've got 40 and 50-year-olds that are not healthy at all. So depending on what their medical status is, their weight, their health challenges, their dementia, their mental challenges, all go into the risk-reward ratio, and I make that very clear in the record. So we either treat, if it's not safe to treat in a mobile setting, then we tell the home and they choose, or you choose, a dentist of your choice. If they're on Medicaid, you want to make sure that that dentist takes Medicaid, unless you're one of the few kids of my patients that have much money. If you have money, then you can choose anywhere you want to go. But most of my clients have to choose a Medicaid dentist, and there's some good ones around that we appreciate much. So if you're the medical power of attorney, you want us to be aware, we probably already know, and it's probably already documented in the record, you are welcome to have a copy of our record at any time. Just ask the charge nurse. I try to tell every nurse I meet that the kids, or the medical power of attorney, can have a copy of our records anytime. It's not stealth, there's not secret. I write it for the children or the medical POAs and for the care plan meetings and for the state regulators. so that they know exactly what's going on, because this information is just not for me. This is used in a series, everything from if mom's not eating to social problems to different things like that. So, not necessarily if a tooth is broken. If we can, we need to get it out. If there's no pain or swelling and there's a risk, um, that will be in their record. But I can't really say age has nothing to do with it. It's got to do more with health, medication challenges, appearance, especially osteoporosis, and especially drugs like Fosamax, which with tooth extractions can create a very nasty what's called BRNOJ, which is necrosis of the jaw, non-healing, that's painful and often triggers a spiral to fail, depression, things like that. So it's just not simple like taking out a tooth on a 40, 50, or 60-year-old. If you have any questions, get my number. If you're the POA, medical POA, call Pam. I'm usually about 10 feet from her. If she's got all my notes on the screen and can go over everything with you. Thank you. This is Dr. Randy Grill.